Thank you for tuning in to watch The Place of Creativity in Public Health, Perspectives from Directors of Public Health. This event is brought to you by our Midlands Creative Health Associate, Jane Hurst. Special thanks are given to Herefordshire Council and Birmingham City Council, whose Directors of Public Health advocated for more support of creative public health at NCCH. This roundtable is part of a 4-part series of roundtable discussions showcasing creative health leadership in the Midlands and beyond. To access other event recordings in the series, please visit the NCCH website at www.ncch.org.uk and view our blog pages. Now, without any further ado, let's introduce the panel.
So, just by way, I'm going to get everybody to introduce themselves so you have an idea of who is who. As I said, my name's Ivan Brown. I was former Director of Public Health here at Leicester until last year when I was upgraded by 2.0, who's sitting in the audience, Rob Howard. So he's now our current Director of Public Health, doing an incredible job for us. And I am, as I said, I'm a Professor of Public Health here at the University of De Montfort, and I'm also one of the non-executive directors for University Hospitals Leicester. You're getting the theme that Leicester is really important to me. I was born in this city, and the things that happen, I was very, very familiar when I was looking at the entertainment and things that happen. That was, if you want to capture what Leicester is, that was a great way of capturing what Leicester is. So I really want to commend the team that did that. So, but I'm going to actually pass on and go down the line and speak about who else is on our panel.
Thank you, Ivan. Is this? Yeah, this is on. So I'm the odd one out on the panel. I'm not a Director of Public Health, nor do I have any ambitions in that direction, just at the minute. But Rob, who is here very briefly, has unfortunately got to be somewhere else this afternoon, so he's asked me to step in and be his representative on the panel. I think my qualifications for doing such were I'm quite creative, I suppose, was your thinking. I work here in the city. I'm a consultant in public health, and although I'm not a Leicester native, I did do quite a lot of my training here. I worked here during the COVID pandemic. I have a real feeling of that the city is my sort of adopted city, and that performance that we've just seen really encapsulates lots of things that I love about this place and this job. So although I won't go into right now what bits are in my portfolio and how that relates to creativity, I will say that it's something that personally I've always felt very strongly about, the place of the creative arts in health, in encouraging health and also encouraging people to talk about their health, even if we're not actually looking to perform a health intervention. So I'm excited to hear what comes out from the panel discussions today.
Okay. Hi, I'm Justin Varney. I'm currently the Director of Public Health in Birmingham, although shortly to go and be Regional Director of Public Health for the South West in a couple of weeks' time. So a bit of transition coming. And I lead Birmingham's Public Health Department, and over the last 5 years we've built a creative public health team, and you'll hear from some of one of our matrix officers with Mac later on, but a network of 5 posts with 5 major cultural institutions in the city, as well as quite a large programme of commissioning different creatives to take what we do in public health and help us communicate differently with our audiences. So today the video from the Poet Laureate from Birmingham, Jasmine, was launched of my annual public health report, where she took a really dry document and turned it into a poem. But it gives you a kind of sense of how I approach today's panel and where I'm coming from in terms of how creative public health fits in Birmingham.
And finally, I suppose, so I'm Stephen Gunther, Director of Public Health for Stoke-on-Trent. Coming back into the building today, going down the Narber Road brings lots of memories back. I personally had personal relationships here with a student many moons ago. That's quite a long years ago. So remember having gigs in these venues, and I wouldn't say it was quite creative. Let's put it that way. And also did my sort of training in the city. So reflecting with Rob and Ivan on some of those experiences. So it was nice to be back in terms of familiar territory in terms of Leicester City. In terms of Stoke-on-Trent, I mean, it sort of talks here about creating for public health, but I think, the city and its heritage, particularly, the likes of Wedgwood you might have heard of, the likes of Emma Bridgewater you might have heard of, Spode, etc. Literally a creative city of taking raw earth and creating it into fantastic things is what we do in Stoke-on-Trent. And we'll just talk a little bit, I would say, been in the city a year now, literally to the day, and really talking about our early sort of findings, what we're doing, but also as we celebrate 100 years of the city next year, just what we're sort of planning and thinking through from a public health perspective, and really drawing on that rich heritage and that cultural creativity in the city, which is fantastic, and talk a little bit more about what we're doing, how we're connecting that to our broader well-being and our corporate strategy as a city council.
Thanks very much, Stephen. So I get this real privilege at the moment of being able to ask questions. Now, you're going to get an opportunity as well, but I get first rights apparently. And I realise as somebody who's sat in your seats that I can actually ask questions that are the questions that I would have not wanted to be asked of myself. So I've kind of started off with kind of where we go from. I mean, for those of you that don't know, there's lots and lots of definitions around public health that are out there. This is the one that the faculty uses. This is the one that all of us, I think, as we were trained, grew up with this. So, and the secret is that very often when we get into public health, we're not entirely sure what it is that we've got into. So this is not new. But I always remember that bit when it says the science and art of preventing disease, prolonging life, and promoting health through the organised efforts of society. And I don't know about you, but when I was doing my training, I did a lot about science. I'm very clear about the science element of it. I'm very clear about what's expected of me from a science element. But I don't remember any modules that really spoke to me about anything to do with art, even though it's in our definition. So I suppose the first question is, should it be there? And if it should be there, why? And if not, why? So let me go. Let's see. Stephen.
Okay, I've caught his eye. Bad move. Rookie move. I fundamentally agree with you, Ivan. It is the science and it is the art of public health, and we're absolutely trained in stats, epidemiology, confidence intervals, Markov models, and all the other bits and pieces that you do in public health, how to read journal articles and so on and so forth. I mean, I think the art, you can look at it in a number of different ways, and I think the collective efforts of society. We saw a presentation, in terms of dance today, and that is a collective effort. You've got to be. I personally couldn't do it, by the way, but got to be in unison.
You just started me thinking about the version of you doing that now.
It's not a good look. Yeah, no, maybe not in the break. So back to the question. So it absolutely needs to be, and I think you're right in terms of, well, what does the art mean? And for me, it's probably three things. One, it's we've got a collective group here today. How do we influence? How do we persuade? How do we cajole? How do we support others in terms of that collective efforts to be creative? Because again, the sum is much greater than the parts. Secondly, then, that art is very much, as Justin's alluded to, well, actually, it could be physical, it could be visual, it could be digital, etc. So, and how does that influence people's well-being? It's not just the health, it is the well-being. And I think, thirdly, in terms of that art, it needs to be accessible. So if we talk about public health, those collective efforts, everybody needs to have that contribute, and the art of getting everybody to contribute is sort of the previous two. So I couldn't agree with you more, Ivan.
Right. So Stephen's there. He's signed up for it. Laura, what about you?
Yeah, I mean, I would certainly agree about how our training functions in terms of being science skewed, and to a certain extent, I don't think that's a bad thing. I guess the way I would see it is that populations are a science to a certain extent. They're predictable. They do what the models say. They do what the statistics say. But people are an art, and that's what we end up doing in our job day to day. People, and in the aggregate, but slightly less than a population at a community level, understanding that, and how people work, how people want to access services, what matters to them, how their lives fit together. You can't describe that with any scientific method. That's art, and I think that's where it comes in, and that's where it's really important for us to be able to understand that we can't apply those models to everything. We need to ask people and listen to what they say.
Thanks. Justin, I left you last on purpose because just being on meetings with you, I kind of already know the answer to this as far as you're concerned. But really, just expand. I mean, what's your view about public health in general and the embracing of the arts?
Yeah, So I suppose what Ivan's alluding to is on the spectrum of DPHs, those that are very sciencey and love a Gantt chart and can do a pivot table and confidence intervals, and those that spend their life talking and engaging and doing the politics of public health. I am way down this end of the spectrum.
That end of the spectrum actually is called the Justin end of the spectrum.
So I'm a strong believer in the art. And I suppose what I would say is, I think, and we really wrestled this when we were talking about creative public health, what is art? There isn't actually a kind of definition. Art and culture are quite broad things, but when we're boiling it down, and it's about communicating through a whole range of different ways an idea, and communicating in a way that speaks to people, and speaks to people in a much more kind of visceral way. It's speaking to their beliefs, it's speaking to their culture, speaking to their identity. And when I've kind of reflected on how that comes together with the art of public health, that is where the interface is. That is the space where we talk about things like well-being, which is a really nebulous phrase. It's also a deeply white middle-class phrase, and that doesn't translate into most languages. And when you're trying to communicate, there aren't a lot of charts and diagrams and stats and research on well-being. The What Works Centre got us some way, but it's still a massive gap. That is a space where you really need to get into the art, because the art is about how are we really talking about the way that people live their lives, their daily stresses, their daily ups and downs, their ability to respond to that and be able to cope with it. And that's where the art of public health for me sits. It's in the space in which we are dealing with the bits of humanity and population health that don't fit neatly onto a diagram, that are really hard to count to turn into a widget. And they're usually the bits that are really hard to change, but they are the bits that are most fundamental to what make us healthy.
Thanks for that. And I guess that kind of leads me on to my next question, really, which is, so we have a lot of conversations, and if we're doing public health properly, we are doing it at that base of communities, of families, of people. We have this nice fancy term where we call it place now, don't we? But fundamentally, it's about people and doing it at a level where people get it and understand it. So how do we use the art of public health or the resources that we could use within public health, not just looking at the science at all? And as you were saying, I'm not decrying the science. The science is incredibly important to us, but we think this is a day for us to shine a little bit more on the art side of things. So how could we make what we do better at that kind of place-based level, capitalizing on the use of creativity, arts, all of those kind of elements? And if you have any examples, please feel free to share some of those. And I'm just going to leave you to battle that amongst yourselves. Who wants to go first?
So I go first.
Yeah.
Yeah, it's a great question. How do we do art in public health? And I think there's lots of ways of doing, but I think fundamentally your biggest and best resource is your people, your population, your citizens of the place where you live. Because as we've just seen, 3 of them doing a fantastic job on this stage. It's unlikely that within your public health team you have people who are, you might do, but expert dancers, expert artists who know how to use those things in a therapeutic fashion, etc. But within your communities, you will have those things, and the likelihood is that they're already there. They're already doing incredible work in the community. You just need to find them and ask them, how can we work together to do this, more efficiently? How can we use it to work towards a public health aim? And we have been doing that. So I guess an example would be during the COVID years, we had our programme of COVID-19 vaccine champions, as they were then called. They've subsequently evolved into our Community Wellbeing Champions Network. But at the time, we were sort of had these parcels of money, and we tasked community organisations to come to us and say, how can you help us with improving confidence in COVID vaccination in your individual communities? And we had loads of really brilliant bids, and quite a few of those were art-based. So we had some organisations come and do dramatic type work at an arts festival, and then one that I've got at the top of my head, we had a mental health organisation who did a creative arts programme, and they got everyone to individually design like a little flag with a message about COVID vaccination or how they felt about COVID, and then they put them all up as a kind of bunting in a community location, and it was visually very powerful and also, you know, creative and therapeutic for the people who took part, because they were able to be together in a way they hadn't been before, encourage those conversations, and it's something that probably you never would have, like a room full of public health people perhaps wouldn't have come up with that as an idea, and yet that expertise was there in the community. So short answer, use the existing expertise that exists in your community.
Great. The experts are out already there.
Yeah, as I say, similar examples, and as I say, within the city, so at Stoke-on-Trent, we're very much working with and through our community. So some of our officers are still getting used to that, but in terms of the assets in which we have, whether it's our physical resources, money, investment, whether it's our people resources in terms of our workforce, whether it's our buildings, land, open space, there to work with and through, particularly if you look at local government and the ability to maintain, even if you like, your heritage buildings of a city, your open spaces of the city, or even number of potholes, etc. So where are the creative ways of filling those? We've had some great ideas of making them colour-coded and not those sort of rainbow streets, which we have gracefully declined. But in terms of then thinking through, well, what can we do and how can we do it, and what are the examples of that? So one of the areas which I look after is our leisure and wellbeing service, and deliberately calling it a leisure and wellbeing, albeit it might be white middle class wellbeing. We'll take that one for another day. But in essence, we've got land, we've got parcels of it in terms of our local communities, and we've got a particular location in Abbey Holton, Wallace Centre, which is an ex-Sportington building, used to be for sort of training development. We've created it into much more of a young people's hub in terms of gym, and it's taken off because somebody from TikTok was doing TikToks in there, so all the young people seem to go in there, which is great. So in terms of that creativity and social media space, we've now got 2 parcels of land in and around it. One was an old sort of multi-use games area, which we're now sort of creating into an open space and connecting the community to create. The brief is make it a sanctuary of tranquility. So we've given the community that space, a bit of resource to be able to do that. And over the next year, we're going to be transforming pretty much what is a not very attractive piece of land for the community by the community. So again, very much similar to working with their ideas, their thoughts. We've got a bit of assets, a bit of resource, which we can work with the community to help and shape and change. So we're doing that in a micro level in terms of one of our services. And then on the flip side, we're thinking through, well, actually, how do we recreate and get engagement with our parks and open spaces? We've got fantastic Victorian parks in the city. Come with maintenance, come with upkeep, etc. Actually, where's the art trails that we can do through those parks, which we're working with Arts Council, etc., and also our local museums, and which to create those, which again give some creativity and let the creators within the city help shape that, but also get others to engage and keep physically active and keep their mental well-being and connect to the green space as well. So for me, it's very much about, well, what have we got to use, whether that's people, whether that's buildings, whether it's physical money, coming less and less. How do we work with, but also then draw in other resources. So last Friday, we had our community sort of day. We worked with a local business as part of their social responsibility. We tidied up one of our parks, but also recreated a range of sort of art installations throughout Harts Hill, just with the local wicker, etc., just so people can find something to do and give people to engage back in that space, which feels a bit more welcoming, a bit more tidy.
So first off, I find the place bit a bit problematic, but I've the challenge and the privilege of 1.2 million population, so I have the largest unitary authority in the country. So we can talk about communities in geographical place, and some communities that really resonates and people connect with them. But that, if we only use that prism, we forget communities of identity and communities of experience. And communities of identity in shorthand is things you look in the mirror and say, I am. And then communities of experience is, I have had this or I've experienced this. So veterans will be a community of experience. LGBT community, lesbian, gay, bi and trans would be a community of identity. And it's really interesting thinking about the body queer dance performance. You know, if you frame that as a community of place, it doesn't work. It's about a community of identity and community of experience coming together. And actually it's about multiple communities of identity coming together. So when we think about how we engage in the art of public health and engage in communities, really encourage people to think beyond the place into those three paradigms. When we think about how we do that, I mean, very much picking on your point about use what you've got. You know, I'm very fortunate to live in an extremely creative city with great cultural institutions, both micro and macro. And there are three examples I give. One, in our public health practice, we're looking at the museum collection, 1.5 million items. We have one item which relates to disabled people. And it's an item of restraint and constraint from one of our institutions, our medical institutions. We have no items which reflect our disabled and ethnically diverse communities. So we've been working with Christopher Samuel, who's the artist in residence at Birmingham Museums Trust. He's creating a stained glass window which will form part of the permanent collection, which is owned by the people of Birmingham, based on interviews with black disabled people living in Birmingham. To start with one item, just to put one item into that collection that is the history of Birmingham, to say, we were here. And using that with my public health team to go, what does that mean to you? How is that reflecting? Because you can look at all the science, all the data of Birmingham, and those communities are invisible. They're edited from our history, because the things that we put into curation are the things that people that have power had value and control. And for Birmingham, you know, we are wrestling with our very problematic history of oppression and slavery and colonisation. So that's that first element of actually how does our experience, how do we use culture to help us understand communities and understand their history and their legacy, and how does that play into today's society and what they enact now? The second is that using creativity as a way of communicating with different communities. So as I mentioned, we've just turned our public health report into a poem. As a different way of communicating. We're in the process of working with Birmingham Conservatoire, which is part of City University. I have 9 universities in the city, so I have to talk to all of them. And that's one of our large music schools. We're also working with UOB's composition course. And we're putting a commission to the students to take some of our demographic data and be inspired to compose music. And use that music then to sit alongside those reports as another way of engaging audiences and getting people to connect, because people will listen to the music and go, why is this coming from some techie report? What's the connection? So using it as a vehicle of communication and engagement. And then the third is around that space of what I would call research and intervention. So where we're actively looking at our arts programming and how can we integrate health messaging into it in the same way we do with our football clubs and try to get messaging into the football programs for a match. Thinking with the Victorian Radicals exhibition, or probably the best one is the feeding chair we had at the Icon Gallery, which was an artistic installation of a chair that was designed around the needs of breastfeeding women. And it was really there to challenge us all in society when we think of public spaces and urban spaces particularly, how that they shame women around breastfeeding and they do not create a welcoming. We create rooms that women can be shut away in, rather than creating thrones on which they can be proud of this important natural process. And how does that play into the reason that lots of women don't breastfeed? So we had that installation. We worked in partnership with the Museum Trust to bring items from the archive, public health leaflets from the 1920s around breastfeeding, which when we read them now are hysterical. Really, the science and the attitudes were really different. But by also then working with local communities to bring pregnant women and community leaders into that space and using the feeding chair as an opportunity to engage them in a conversation around breastfeeding in their communities, but also to work with the artist about how that feeding chair was being received by different diverse communities, so that as she takes that chair to other cities, she's iterating and developing it as it moves forward. So for us, really thinking about how creative arts can challenge our public health practice, can help us better understand communities, but also can create different ways of engaging and talking to people about important public health issues.
Thanks very much. I'm going to hand over to the audience in a minute, just but one last question. It was as all of you were speaking, really. And I think over the years, public health has done such a good job of being in that scientific space that when I hear you sort of saying, oh, you know, we are using some of our money to do exhibitions and commission arts installations and do all. Now, maybe it's just me, but I'm thinking about having that conversation with my head of finance and having that conversation with my exec and my mayor, because they don't see public health as being that. Top tips from you. How on earth do you get to move that narrative of what people think public health is, because that's what we've told them that that's what public health is, to this space which has always been there, to say actually, no, it's this. What levers have you used? What levers do we have in order to be able to move that forward?
Okay, I'll start this time. So I'm as DPH, I just have responsibility for public health, which is relatively unusual now. And that gives me a kind of benign dictatorship, in a sense, over the grant, which is helpful. And COVID really helped reinforce that, you know, public health, DPH tells you what to do, and that's, you go with it, because it's generally for the safest option. So I've been really fortunate to have politicians who get this, get my approach, get my creativity, understood that when they appointed me and kind of knew what they were getting, and have worked with us on what we've got. I think the most powerful step, I mean, first of all, we started small. We didn't put a huge amount of money at the beginning. We started with about 20,000 and gradually built up. And I think now, all told, it's probably about $750,000 goes in each year into creative art interventions in different forms. We were very broad. So we did start with, just prior to COVID, we started with some work on infant feeding, and then we moved into some work on physical activity through dance, particularly for our Bangladeshi community. And then in COVID, like many others, we went online. We commissioned YouTube videos using crafting for bereavement support, for example. Then post-COVID, we've got more ambitious, and we managed to ramp up the money in different ways and form partnerships and use it in that way. But through all of this, we've kept quite a strong link to evaluation. We've had a program to develop an arts-based toolkit on how to evaluate impact. So we might commission you as a dance project, but I want you to fill in short active live survey on physical activity before you participate and afterwards, and then preferably 6 weeks afterwards as well. So I can tell as a commissioner whether taking part in a one-off dance event makes any difference to your daily physical activity or not. So we have been quite hard on, you know, you get our money, but you have to sweat for it, literally, as well, I think, in that sense. And then I think also public health in Birmingham has been at the front of wrestling with our incredibly now super diverse, I'm not a huge fan of the phrase, but I would probably call white minority city status. And what does that mean? And how we've worked with elected members to kind of talk about that and move to a space of cultural and community curiosity, and them seeing this as part of that journey. That being at a time when we're in financial restraint, all the funding to the arts is being slashed and cut. So to some extent, the politicians are like, right on, Justin, you're at least giving something to the arts while we're cutting everything else. So that has also helped. But I do know we're an outlier. And you know, I have the advantage of the largest grant, one of the largest grants in the country, and therefore have more freedom than many colleagues. But I think it is about evaluate it, show it has an impact, tie it tightly to the things that they understand public health is for, and ride the political wave.
Yeah, I think I might just jump in there. I think that was really interesting, and it's really interesting to hear a city the size of Birmingham and how you go about doing it. And I know, you know, there've been challenges in your city with arts funding. I'm a musician, and a lot of the petitions and various other things have made their way past me in recent times. I think in terms of, you know, that was really helpful and very specific. I think maybe in terms of thinking more broadly and perhaps a little bit more abstractly, public health actually has never been a fixed entity in terms of what it entails. You know, we don't need to go back very far before we're looking at it purely as a sort of hygiene, disease control, those sort of things, entity, and we've come a long way from there. And recently there's been a lot of discourse online about, is it time for a fifth wave of public health, something where we take much more into account of those ideas of place, albeit I know that's not a perfect way of discussing it, community, and thinking more about these more abstract artistic concepts, because actually that's a huge part of what makes us healthy or otherwise. And although that's going to be a difficult argument to make in the context of a financial crisis, as it were, I think it's important to not forget that and to keep pushing that narrative, and we need to keep moving forward in terms of what we consider to be our job. And then the other thing I would say is that idea of proving that what we're doing is making a difference is everything. And one of the things I do as part of my job, I do some research and academic interests, and I'm very keen on pushing the idea that just because something doesn't fit into a model of a placebo-controlled, randomized, blinded trial doesn't mean that the evidence that it produces cannot be really high quality and really useful. And there's a bit of a paradigm still of health-related intervention. Like, if it doesn't fit into that, then we're not interested. And actually, I think trying to encourage those different the methods of research that fit better those big arts interventions, sociological things, and pushing those forwards, because they can be incredibly useful. And when we've got a really good evidence base, that makes it easier for us to say, look at this thing, we know that it really works, let's do it. But it involves a little bit of a push, I think, from everyone, and it's particularly difficult for those working in academia because you've got to get a grant to do that research. So I think there's a little bit of we need that paradigm shift within the health research community towards acknowledging those other kind of methodologies of assessing intervention. And from our point of view in public health, just embracing that actually, things change.
Definitely. Go ahead.
Yeah, I was just reflecting on those two comments. As I say, a phrase that sometimes comes to mind is, public health is not just for pandemics. Mm-hmm. We do other stuff. And actually there's quite a lot of stuff we do. So we are speakers and conveners and of many different languages of profession in and out of a local authority setting, NHS setting, national, regional, local government. And you think about what about the decision making? A lot of decision making in terms of where we put my time, energy, resource is political, big P and little p. So what's the influence? How do go back into the art space? How do we influence that decision making? Where do we shine a light on those areas that are not shone and make a difference? And if we think through those fundamentals of well-being, which is a good home, good job, good social network. If we think of just how you felt watching the performance there. I had a smile on my face. I enjoyed it, and actually, how does it bring and encourage others, which is a crucial element to where we put our time, energy, and effort. So we've got to think about those ideological and political decisions, in which what's easy to cut and because we are in a financial difficult. What do we have to do? But then, secondly, how do we align it to our greatest need? So just as an example. We battle it out in Stoke-on-Trent between Blackpool, between who's got the highest number of children in our care. It could be us, it could be them at any given time, which isn't the great place to be. And part of that is how we work and treat families, and where we are on a professional basis. I think it's better in the state. It's not always better in the state in terms of care. So how do we nurture and develop our children and our families? So we've got a whole programme around family matters. In the city, because families matter to us, and they really do matter to us. And as part of that programme, working with families in the community, because it has to be the community, we work with what we describe as locally trusted organisations. They're trusted by the community, not necessarily us, because some parts of the community have deep-rooted distrust in statutory services. So actually, I'm not best, our professionals not best to work with those communities. And a key programme that we've got developing is, again, looking at the assets in which we've got across the city. How do we use arts? How do we use equine? How do we use theatre, drama to work with those families? As it might be an outlet. A screaming session might be great to release anger and so forth within families, which actually keeps those families together. And financially, if I go to my 151, my leader and our sort of finance politician, they really want us to keep the children out of care because this is costing us a lot of money. So when it comes to those decisions, absolutely evaluation and absolutely look at the impact in which these things are making. Yes, they might be quantitative, but also qualitative. So going back to how people feel, how people interact, and what's the general mood music of a place, of a city, of a subjective neighbourhood, because people view their places and geography is different. It's not just a geographical or political boundary or what ONS decides to draw a line on. So in terms of those conversations, for me, it's that art piece of working with our politicians, looking to get them to advocate and support projects, ideas, absolutely evaluate whether formally, informally, and get both the quantitative and qualitatives, because that's equally important. And also think through where are we in line with other strategies. So we've got our local plan in development. I want to put some supplementary planning guidance in there to create health and art spaces as part of the decision making, which will give us another 20 years, 30 years of decision making to put arts and health into, or creativity into some of those physical spaces across the city as well. So it's not just the money bit and the resources bit, it's also how we shape and rethink how we think, firstly, how we decide, secondly, and how we then act, thirdly. And I think that is, again, the art of public health.
Thanks very much. Now, I want to sometimes take a seat and be able to actually answer some of the questions as well. But I really want to hand over to our audience, really, because I'm sure they've got questions that they would like to ask. So can't really see too well in the dark, but if we've got a roving mic somewhere, if anybody puts their hand up, over here, great.
Thank you. Thank you for that really insightful discussion that you've chaired and introduced there. My question is, and I'm from a university, so I'm one of these researchers, is it seems really positive that this discussion is happening nationally, but I wondered what kind of investigations you were doing and what you had discovered, if anything, about how this is being handled on a global level, so outside of the UK, what's going on in what I know personally in Singapore, in the US, in Canada, in Japan, across the world, the ways in which this is being handled, and if we're learning anything that we can apply in this country from those other global places.
Do you want to take that one first?
Yeah, I'll kick off there. So I think two things. So I'm a huge magpie. If someone else has a bright idea, we'll totally borrow it and adapt it. So a lot of our approach to particularly considering artifacts in the context of cultural conversations is based on approaches in Canada. The use of communities of identity and culturally appropriate dance has been used globally in lots of places, but particularly we looked at Australia and we drew from that. So I think we do talk. What we've not found is the city network so we're part of a global city network working on food systems. What we haven't yet kind of joined or found is a kind of city network of creative public health, and I think that is still a bit of a gap. I think the other thing that I would say internationally is really interesting is how in different member states, and this is where I slip into WHO speak, governments consider the positioning of arts and culture. So sometimes it's a standalone government department. In our administration, it's merged with sport and digital, which is an interesting kind of marriage. And the power dynamic of where that sits in government policy has a huge implication on how does it work in cross-government policy, and then how that is implemented at a municipal level and through. And then alongside that, in every country, public health sits in a completely different bit of the system. So speaking to your point, if you're in Italy, sanitation is your number one public health job. And then you have a very, very large bit of what we would consider like the NHS. And then the health promotion bit is kind of way down there. So I think yes, we look internationally, but I think you also have to look at it through the context of the political positioning and the cultural positioning of art and creativity and the political positioning of public health, and then are there opportunities where they bring it together in a sustainable way? Because the other thing that I see internationally, we're really good at this as well here, is one-off, 1 year money, 2 year money, end of the project, bye-bye. And very, very few countries or cities actually have developed a sustainable model with multi-year funding and multi-year commitment. We're still very good at producing jewels. We're very bad at wiring the necklace.
Yeah, I think, absolutely agree with all of that. And I think I think there are actually lots of things that we can learn from the global community as sort of people who live in Britain, England, and obviously we are all culturally very diverse, but there's a few things that we sort of share. And one of those things that I've always found when I've been in other parts of the world, no matter where I go, you'll often meet a group of kids or a group of people from a settlement village, and they'll be already sort of communal, like music making and other creative stuff that just happens as part of how they are. And they'll say to you, oh, welcome, nice to see you. Can you sing us a song? Because they're kids, they love it. And I'll be in a group of people and everyone will be like, oh, I don't know any songs. Which is a lie, because everyone is born knowing at least 3 Beatles songs, let's face it. And we all know Happy Birthday. But it just seems to be that slight, a feeling here that creativity, and particularly musical creativity, is not for everyone. You can only do it if you're good at it. Rather than something that we should do together for joy and without judgment. And I don't know if that's something that we once had and lost. Certainly there's a lot of pub singing that goes on in Sheffield where I live, where they're certainly not worried about quality, but it's still very joyful. And that's been my experience working in other parts of the world. So I think we have that to relearn, perhaps, that value of just communal music-making creativity without caring about how well we're doing it. But I think what we don't have is that sort of global consensus on the place of art in health yet. I think it could come. You look at the evolution of the Sustainable Development Goals and where they've come from the original Millennium Development Goals, and they've become much wider. So I think that could be something for the future. But certainly it's not there yet. But we could get there.
Yeah, I mean, as I say, echo the previous points, and being I suppose, a world capital of ceramics helps sort of bring people to us, and I think we are looking to embed that, particularly in our conversations around our economic strategy locally for us in the city of Stoke-on-Trent. I mean, and I suppose it strikes a chord if we look at urban, majority of the global population now live in urban areas. And you've got five key things in which make a good place. Geography. I have to keep correcting myself now. One, good access to health and care. In the UK we do that. Yeah, obviously there's issues and everything else free at the point of use. Compared to many other global countries, we're doing pretty well. Always more to do. Secondly is perception and reality of crime. Do I feel safe? Do I feel I'll be able to go out? What is the role then of our community and society and eyes and ears to feel safe, and that goes into built design and everything else in that space. Third is around your economics. What does that mean? Whether it's digital, whether it's physical, your skills, education, training, jobs, education, putting it into arts, creative elements within, making that important within the education system, which again in the UK we do okay in, could be better. It's always argued we could push that further. 4 is trust in politics. I usually leave that to the politicians. Trust in democracy. So we usually leave that to them in terms of their open transparency, and we do okay. And I think the final bit, which is what do you do at the weekend, or what do you do at the evening with your friends and family? And that's your leisure, that's your culture, that's your heritage, that's your arts, that's your theatre, that's your cinema, that's your music, and what do we do as those urban spaces to really create, you have the nighttime economy conversation, or how do you draw in footfalls? You can argue it from an economic piece. What is Montreal done, or what is Mississippi, et cetera. So you can see in terms of those global places where we know music is draw footfall through, and it makes an economic sense. So you can start to learn and have those conversations at a local place to draw in those experiences and draw from others, and just like Justin, still with pride if it works, and adapt it for your local area. But I agree there is probably more for us as a sort of professional community to, we've got the Creative Arts for Health Network sort of UK-wide, but actually how was that going to then be global? And I don't think we're quite there yet. So how do we start to create that more broadly. And we can do it through academic means, or we can do it more through policy means, and why not explore it?
I'm sitting down, so I'm allowed to answer a question, right?
That's true.
So I think the other thing that I was going to say was that I think we've also got to be intentional. I think we've got to be intentional about building it. So sitting here at the university, we are in the process of trying to develop a Masters in Public Health, but very much around that international look, very much around recognising that the levels of expertise do not reside here. They reside internationally, and we need to celebrate that. We need to look at how we do that. We need to get the next generation coming through should look a lot more arty than we do, and I think we've got to be advocates for that. And one of the things that you find is that as you start to have those conversations, you start to draw more people. I mean, right now, these guys don't know that they're going to be helping me on my course, but we will draw more of those people to help equip our students that are coming out, because those are the seeds that are going to go out and say, actually, I've learnt from here, I can do this. And I think the pandemic helped us on that, because I think it humbled us in terms of recognising we haven't got all the answers. And we saw areas where community was strong, where people were saying, oh, it's going to be a bloodbath, it's going to be terrible, it's going to be awful, where they had developed really strong community assets and managed that pandemic without money and without resource in a lot better ways than some of us did that had those things. So I think we are in that space of opening and learning around that.
Thank you very much. Listening to the panel, thank you for your contributions. It seems like creative health is asking for a changing lifestyle, because it seems to be, in talking about assets and in talking about some of the interventions you've spoken of, it can be used to develop new ways of living, new lifestyles which are maybe more healthier, like you were mentioning, returning to communal art making. Is there an area within public health that looks at lifestyle? We began the conversation talking about how science is, foregrounded in public health. Is there, within the discipline of public health, an area where lifestyle is interrogated? Thank you.
I'm going to do the 3 domains.
I'll stand up. I'm the facilitator again. Off you go.
Okay, I'll do it. So the reason we're all looking at each other is because we're working out who's gonna talk about the way that you split public health practice up, because there are lots of different ways of thinking about it, and none of them are perfect, because actually it's like a Venn diagram and loads of stuff crams into the middle where it all overlaps. For example, you can't talk about lifestyle without talking about health systems and other things, because we're not isolated walking systems of physiology. We're all a sum of our parts and those of other people. But we broadly tend to split it up into 3 bits. So we talk about health protection, which is protecting the health of the population from infectious and non-infectious hazards. So that's a lot of the stuff that came up during COVID: outbreak management, chemical incidents, fires, that kind of stuff, emergency planning. Then there's healthcare public health, which is kind of looking at how we design services, how healthcare money is spent in terms of pursuing equity. So trying to make sure that we do the best things for the right people in the right place at the right time. And then the final kind of area, sometimes people call it health promotion, sometimes people call it health improvement, but that's that sort of nebulous area of things that relate to, I guess, what you would call lifestyle interventions. So things like smoking cessation services, helping people to eat better, lose weight, become more active, all of those things. But in reality, actually, there's an element of that in everything we do, because although those are our 3 domains of what we do, what we're about is trying to address inequalities in health, and actually to do that you need to look right the way across. So I hope that answers your question.
Thank you.
Yeah, well, as I say, I'll just sort of add to that as well, and I think, a reflection of us as a profession. I personally hate the word domain. So if you look at the definition of that, it's where we guide, rule, and conquer any particular space. So going back to I suppose that changes about giving away those views, my personal, why can't I share my skills and expertise with anybody? It's not my space. And I think also in terms of the evolution, just a reflection on the conversation earlier around the 1920s sort of leaflets and pamphlets, etc., which public health is on an evolution. We need to look and act in different spaces. We need to consider, well, what are those drivers of the drivers of the drivers, or the determinants of the determinants of the determinants, or the causes of the causes of what creates a good, healthy individual, community, society, and so forth. And I think where we spend our time, energy, and effort, going back to other questions, is changing. And even if you look at us, from the professor at one end to obviously I'm the young whippersnapper of the men, physically look different and dress differently. So I've never worn a tie, and when I came into public health, everybody wore a tie and was an old bloke. So I'm going to be that old white bloke soon. But I think we need to bring in other views, other voices into the profession.
I've got yellow trousers on, I feel like that.
Yeah, we're doing the Bollywood scene, but yeah, Bollywood.
As someone who sits within an arts organisation but whose role is funded by Worcestershire County Council's Public Health, I'm particularly interested in kind of all that, how you use communities and cultural organisations within your areas of public health, but also how you measure the quality of the artwork, both through the process and the end product, or whether that is not so important if it's funded through public health and it's more around participation.
Should I kick off on that one? So if I take them in reverse order. So first of all, when I talk about creative public health, I think about, and it took me a while to get here, art and creative opportunities being from kind of universal, so public art, the curated, so a specific exhibition, targeted, an exhibition which has a specific theme for a particular audience, facilitated, which will be a talk at that exhibition for a particular audience, and then an intervention, and then at the far end you've got art therapy. So that's the kind of spectrum that when I'm thinking about using creative vectors, I think across the range of it. And then that you get into that question of, well, what is good art? And the Icon, which is our contemporary art gallery in Birmingham, has a particular strength around video performance type art, which I really struggle with personally. I just don't understand. I don't get a lot of the Icon art. And I know the director well, they take me around the exhibition and I kind of nod and I smile, but I do not understand why this mound of clothes, very Tracy Emin style, it doesn't speak to me, it doesn't communicate in the way that, say, the Pre-Raphaelite exhibition at the museum did, or some of the performance poetry and the music that we have at the MAC. And that gets me to a position of going, it's not, as a director of public health and as a commissioner, I'm not judging whether the art is good, because the reflection of whether it is effective is the bit that I care about. And whether it's effective or not is it connecting with audiences? Is it engaging them in the conversation we want to have? And are we then able to show any impact or change? So we're working at the Hippodrome, is where our theatre-based matrix role is. And we've just had Hamilton in Birmingham, and the touring company. And the theatre lead, Jay, worked with the Macintosh group to change the way they profile and invite young people to the audience. So historically, they basically just said to schools, here are some free tickets or very reduced tickets, send who you want. And we said, no, hold on, let's work with schools who've got databases. We can create an algorithm that will help you get these tickets to the kids that are least likely to ever step foot in a theatre and are at most risk of developing health issues. And then we gave them a kind of pre and post questionnaire, but we also gave it to their parents and to their teachers. And through that evaluation, I've just seen the first cut of the data, Jay's able to show that that experience of Hamilton is impacting those kids' perception of self-esteem using metrics that I would recognise as a health professional. But also we've played that back to the Macintosh group, who've gone, oh, we never thought about inclusion in that way, and we're going to change the way we work with schools now to invite youth audiences. So there's a kind of perpetuation of it. And that, for me, I mean, whether I like Hamilton or not as a musical is irrelevant. The intervention using the creative vector has achieved an impact that I can measure and I can validate. And that is more important to me than whether it is good art, because I think that's a completely kind of subjective decision. in terms of the connecting with communities, what we've learned in Birmingham is to test it and try different forms of art land differently with different communities. I started with a very white middle class view that dance was brilliant for our South Asian communities, and for some of them it is, and it works really, really well. But there's quite a lot of our Pakistani community who don't give a damn about Bollywood, and it really doesn't engage with them. And that there are other things that engage with them much more in terms of creative space. So being open to both hearing the feedback from communities about what they want, and we've used a very open grant-based approach for funding to allow community organisations to come forward with that and propose it and then tried it and then grown from that, rather than me kind of going, this is what good art is for your community, because that doesn't work. So it's given us a much more kind of organic approach. And there are whole loads of, I mean, don't start me on the Grime Festival because it is totally not my bag. But as a way of talking and engaging young people in our city who are most disenfranchised about their mental health, it's amazing. And actually working with those kind of spaces. And sometimes that means I've had to get really uncomfortable with what I consider art and culture. But that's part of being a DPH, is learning to be uncomfortable, because you need to get there to get to the real stuff.
So funny in that I've had this argument with my dad on many occasions. He was very much in the school of, you know, why is that pile of clothes art? I could do that myself. And I think if you ask my mum, he does do that on a regular basis, ignores the washing basket. But I always think, my argument back is I think good art is just art that does that which it sets out to do. And it doesn't matter what that thing is, but I think it is important to be intentional about it when you start. And that's true whether it be, you know, you're playing in a symphony orchestra and your purpose is, you know, your audience are then paying to hear a performance of Mahler or whatever. You don't want it to be rubbish. There's a reason there to aim for equality. But if you're aiming to create a piece of art that provokes thought or provokes discussion, or, you know, as long as it does that, it doesn't matter how it gets there. And actually, to a lesser extent, that's true for things that we commission as creative arts projects. As long as we're clear at the beginning about where we're going and what we want to achieve from it, if we do that, the sort of creative output can actually look like whatever it looks like. You know, it doesn't need to be good, however you might choose to define it.
I think the examples that you've given, and just in that one that you gave, is a really important point, which is you've got to recognise that we as public health, and if we're utilising, you know, art outlets, we have to go on this journey together. We've got to be better at understanding what it is that we want, but also, you know, the art institution is like, it's art, it's good, right? But actually, we kind of need to say, we get that, but how do we show that? And that's what brings around the change. That's what brings around the change in the Macintosh group, who said, you know what, we're now going to do that across the country. So this is a journey that I think that to do it really effectively, we've got to do this together. So it's going to meet, you know, both of us meeting at different points.
Thank you. Hi, I'm Rosie Dalton-Lucas, and I'm a magpie from Southwark, in one of the London boroughs, where we're also really keen on progressing the creative health agenda. I've got colleagues from the GLA and SEL ICS. My question was really about when can we move on from, I guess, the need to evaluate everything to death and think about where in the system we can make some big changes about progressing how creative health is part of our whole system. So I think we've got a lot of great evidence now to say, this is a good intervention, let's do it. And yes, we need to keep saying, measuring, is it working well, can we tweak it, etc. But it feels like there needs to be some big levers we can pull next to kind of bring about the scale of change that we need. And I wondered what your thoughts are in terms of what those next big steps could be.
I'm probably going to disagree with you a bit on this, because I think actually one of the values of, I think there's a bit about the scale of change of getting creative public health approaches just acknowledged as they are valid and part of the system, and that I'm up for scaling. But actually the value of the vast majority of the interventions we do is that they are relatively micro. And they wouldn't work if we scaled them across the whole of Birmingham, because they're very community specific. They're geographical place specific, or they're community of identity specific. And also the artists that facilitate them can't scale. I mean, it's one of the really interesting challenges, and we saw that, and I forget what the program was, Ivan and Stephen might remember, the dance-based program on physical activity a while ago that kind of went round, and it had a good evaluation. It was RC, randomised control trial, and it was really encouraged. But the challenge was that actually it became a bit like going to a gym session rather than going to a creative dance session. And there was quite a lot of variability. The dance instructors were trained how to deliver the program, and that detracted from some of the creativity of the dance and the dance experience. And certainly in areas where I'd commissioned it and then chose not to commission it moving forward, there was that kind of dilution. So I wonder whether there is a question around, is the approach to scaling about approaching the ideology so that public health professionals no longer need to apologise for commissioning art organisations as providers, and we get and providers learn that this is a pot of money you can apply for. I mean, we've had to do a lot of work with creative providers to go, it's okay for you to bid for this. You don't have to be a health charity to bid for the grant. We really want to see your bid, and that's part of what the matrix roles do. But actually we want to move to a way where we've got a garden with identified beds of flowers and vegetables, and some wild meadow space as well, which is teaching us what we don't know, rather than necessarily this has got to be a French garden, everything's in rows and everything's done the same. So I think certainly the approach we've taken in Birmingham is we're getting to a bit more orderly English country garden, in that I know what's a vegetable and what's a fruit and what's a flower, but I've still got quite a lot of wild meadow space where I'm having a play with the sector and working out what works. And I think that's okay. And I think if we try and regiment it too much, potentially we risk killing the impact. But we do need to make it more normal.
Yeah, and I suppose just to sort of add to that is, well, what's your time frame? So there's an old sort of conversation with the leader of China of a couple of years ago was, how do you think the French Revolution's going? And he said, it's a bit early to tell. So it depends on your time frame and your view. And if you think about, again, we've got the centenary next year. So my annual report's going to be 100 years of the city, and I'm sort of dipping into the medical directors and previous directors' annual reports over that last century, which is fascinating. So 1967, the local group went off to Blackpool, local children's group went off to Blackpool for a weekend, and that was part of their therapy, or there was light therapy as well, or actually social care were working with health, and this was a big thing. And the wonderful little vignettes of practice, and some of which we've forgotten. So if we think about, going back to those fundamentals of well-being, a good home, a good job, a good social network, and you think about, well, actually, again, look about the Victorian infrastructure around our parks and open spaces, going back to sewage and drainage, and those sort of elements that actually bring us together. So in my view as well, actually, what's good public health practice now? Whatever I'm doing today will be rubbish in 5 to 10 years' time. And how do I start, going the earlier question, and linking in with others? Where are the innovators? Where are the creators in different spaces to create, ultimately well-being of our community, good, positive outlook on life? And again, where do you then shape over the next 10 to 15 to 20 to 30, 40, 50 years? And what are the things you can do now that will create that space, as Justin's talked about, whether it's the meadow or the cottage garden or regimented sort of visual sort of gardening, etc. That's a different argument with my wife at home. I like more regimented, she likes more free-flowing, but I do most of the digging. But it goes into the what's your viewpoint and what do you want to change, and okay, well what do you want to change in the next 3 years, 5 years? What would that look from now, and what are those signals of change you want to make? Do you want your local directors of public health in the north of London or south of London or east of London or central London or the GLA to actually say, right, actually this is really important for the City of London. what can we utilise and how do we change it? Similar to Birmingham, similar to Stoke-on-Trent, similar to Leicester City. What can we do now that will have that lasting impact? What will we do tomorrow which will be something different? And how do we learn and continually evolve? Which, ultimately, as directors, we're here to protect and promote the well-being, reduce inequalities of our population. That might be an art conversation today. It might be something different tomorrow. So it's about continually looking, continually evolving, and again, yes, assess the impact, but you can do that on a broader basis, and you don't have to evaluate to the nth degree on certain things. We've got a good evidence base and a growing evidence base, whether that's quantitative or qualitative. And I think the qualitative element is also mightily important. So time frame is one, continue to evolve, and have a sort of clear view of what impact you want to make today to have that impact for tomorrow.
I think probably another place that you could think about system change for this that doesn't require a huge paradigm shift at national level would just purely be about who you have in which conversations, and particularly those conversations that take place at system level, especially with sort of ICB commissioning health colleagues, who's in those meetings, because often those are the places where not decisions get made necessarily, but ideas get bandied around and things get brought forward. And if they're all people like me, I'm not massively creative in terms of thinking about solutions. I'm not going to come up with stuff like that. Whereas I was in a meeting recently to talk about some research that colleagues at University of Leicester have been doing about the experiences of Black Caribbean women from the city in motherhood, and we were talking about how we take this forward in terms of improving experience and trust in the system and all sorts. And we were talking about, can we do training for staff? Can we do various things in terms of clinics, etc.? And there was a representative in the meeting from the creative health arm of one of our trusts, and she said, oh, well, we've got a brilliant archive of old leaflets and some like childbirth. They've got an old breast pump and an old like a chloroform thing, obstetric instruments and stuff. Terrifyingly, the obstetric instruments look very similar to the ones we use today. But and she said, oh well, these often provoke conversations. Why don't we use these to provoke some conversations? We can get someone along to make notes. We can perhaps get someone to create, to make this into a poem, and then use that to kind of inform how we go. And that approach is not anything that I would have thought of, or anyone else in the room, which was full of lots of people who work in health. So I think there's something about when we're thinking about our core membership of decision making fora and when we're planning services, is there somebody here who actually is who knows creative health and the place that it can play and can signpost us in the right direction?
I think the point that I think when I was asking the question around barriers, it was kind of alluding to your point. Because whether we like it or not, the reality is we operate in an economic environment. So everything for us is around opportunity cost. Everything around, I have got to show that this is better than that. Because people say, we want maximum for our money, So I think for me, some of the stuff that we've worked on, certainly within Leicester, is how do we just make evaluation easier? How do we just make it so organisations are not jumping through 1,000 hoops? What is it that we actually need to know, and how we can collect that? Because what that allows me to then do is stop this nonsense of, I've got tuppence halfpenny for you today, but you've not shown me how this works next year. You're not showing me. And I'll say, well, we've got a strong evidence base that we did that. Yeah, but that wasn't here. That was somewhere else. So I think for me, where I kind of want to, it's not my job anymore. Where
you're going to tell us.
Where we want to be on this is I want to make it as simple for organisations to show and highlight that this work that they're doing is great, and it really has an impact on people, our people, the people that are in this city. So I think that's been one of the things, and I often smile when people are talking to me about evaluation. I said, listen, do you know how long ago it was that we discovered that smoking was bad for you, and how long it took for us to actually get anything meaningful, that big lever to do it? So it's not just about how you may be feeling. That's kind of been the history. So I think if we can make evaluation quick, easy, relevant to those communities, to our communities, that gives us the power to go and say, in that opportunity cost conversation where you're thinking of having this shiny thing over there, we'd be far better spending that money over here within our communities.
No, I mean, if I can add, I mean, I think the other point, and I started my career in London, and trying to get the 32 boroughs to agree to anything, let alone agree with the GLA, is pain on earth. But if London can achieve a consistent way of measurement across the whole of London for this, then, because the thing, particularly in London, I think, having left London, I have far less stress about that than I did when I worked in Barking and Dagenham. But in London, there are arts organisations that work across multiple authorities, and if each one's asking a different way of measuring, then they are killed by evaluation. And I think there is work that we can do in the Midlands to get more consistency across authorities to help creative organisations, so that not only do they get consistency on the same project that crosses boundaries, but they can then also percolate and spread and seed their projects in other places without having to go, oh, and I've got to do a different evaluation framework. So do it once and do it consistently for everyone will make life a lot easier.
I think the gentleman wanted to make a follow-up point, Jane. I don't know if we've got time.
We are past time, so we're going to have to close the panel.
Okay.
But a big, big thank you for our panel today. Please give them a hand for joining us and making space in their busy schedule.